I've lost 6 friends to overdose.
For the last 14 months, Dennis Allen Gaudette Jr. has been in substance abuse treatment remotely, a newly expanded option for addicts seeking help thanks to the pandemic.
You don't have to be at their office. You can do it wherever there's an internet connection. It's been a huge lifesaver.
Dennis's story starts like so many others.
I was working construction and I blew a disc in my back.
He was given Vicodin to help manage the pain, but after 10 months, his doctor stopped filling the prescription.
And that night, I was laying fetal position on the floor, curled up in a ball, soaked in sweat, crying because I didn't know what was going on. I thought I was going to die, honestly. So I fed my habit on my own.
According to the Substance Abuse and Mental Health Services Administration, in 2017, 2.1 million people in the U.S. had an opioid use disorder, an epidemic with long-standing barriers for treatment that have only been exacerbated by COVID-19.
There is limited access to evidence-based addiction treatment across our country. There has been a huge mismatch that has only grown in the pandemic.
Pre-pandemic, Dr. Baston says one of the largest barriers for treatment was the strict regulation of medications like methadone, which required patients to visit a clinic every day.
You literally have to drive or take buses or take, a ton of different public transportation, sometimes for hours, to get to a central location where you can physically take this medication while being monitored.
There are also shortages in providers who are able to prescribe these medications, plus the stigma around drug addiction, co-occurring mental health disorders, and a lack of reliable transportation.
We don't have the infrastructure to support all of the addiction and mental health needs across our country right now. It just doesn't exist.
Dennis was able to find help and get a prescription for Suboxone, the brand name for one of the 3 FDA-approved drugs for opioid use disorder. But living in rural Maine made it difficult to have consistent care. He says over the last 10 years, he's gone from program to program.
I went a year, and I was trying to just buy Suboxone on the street until I could get another doctor because the waiting list was so long. And I ended up on heroin and fentanyl.
And in 2021, Dennis says he didn't have a provider that would treat his addiction along with his anxiety.
So they're making me choose between my addiction, getting that fixed, and my mental health. That's when my doctor looked at me and he said, he gave me a card for Bright Heart Health.
Bright Heart Health is a telemedicine provider offering addiction treatment and counseling since 2016. An in-person evaluation used to be required before receiving any treatment. But when the pandemic hit, an emergency order from the U.S. Department of Health and Human Services loosened some of the rules, allowing providers to prescribe addiction treatment medications without the in-person requirement. Now, with COVID restrictions being lifted across the U.S., doctors and politicians are pushing for these COVID-era rules to be made permanent.
This is life or death. It's not a convenience factor.
Republicans and Democrats in both the House and Senate have introduced bills aimed at preserving flexibility in addiction treatment.
What our bill very simply says, under medically supervised recovery treatment, you can be prescribed methadone from neighborhood clinics. You can get a week, 2 weeks, up to a month, just like you do for diabetes and insulin.
A study published last year in the National Library of Medicine found that participants of telehealth addiction treatment were just as successful as those treated face-to-face.
They found after 2 years of this pandemic is that the naysayers who thought this would increase the complications of being treated, it was just the opposite.
For Dennis, he hopes to be weaned off of Suboxone completely by July.
Very excited to go camping sober for the first time in a long time. Even though Suboxone is such a low dose, it does still put you in a little bit of a haze.
A long road to recovery, hoping to achieve a clean start.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.